Hey everybody, it's Teresa with Foundations Wellness, and today we are talking about anxiety in children. And so I am speaking with our amazing Jen Losee, our certified pediatric nurse. She is so passionate about helping you with your kids. And today she's going to talk to us about the subject of anxiety. So what does that usually look like in kids?
So anxiety in kids really can present itself in many different ways. A lot of times it depends on the kiddo, a lot of times it depends on the age. There's many different factors and the situation too, but for the most part it's exhibited in their behaviors. Are they acting out? Are they becoming physical? Are they a little bit more withdrawn? So your teenagers might become more withdrawn. You might see some resistance in activities that they typically would do without any issues, and then all of a sudden they are refusing to go to school or refusing to do any social interaction that they normally would do without a problem. So really it just sort of depends. There's many different ways it could present. But those are pretty much the main ones.
Yeah, and if your child seems to be demonstrating one of these behaviors, showing that they have some anxiety, what does that impact on the mom and the dad?
Well, the mom and dad, it can impact them many ways. Emotionally, nobody wants to see their child distraught and not themselves. It can be very concerning. It's a very stressful period for the family as a whole. It can cause them to have to stay home from work. Lots of issues and lots of stressors that are involved around that.
It's something that you and I talk about all the time, is how anxiety is really getting normalized in our day and age. With me being a lot older than you, but just me being older, I remember the day when you just didn't see these anxiety issues in kids. You just didn't see it. And yet now it's kind of rampant. And I think what hurts our hearts, both of us, are that when young parents are looking around, they're seeing, well, everybody's kids act this way. Isn't this just normal? But then when we talk, we say, and then when parents bring their kids to us, because some do, we realize it doesn't have to be normal. It doesn't have to be this way. So I think Jen really wants to talk more about what are some of the treatment options, what are some of the traditional treatment options that parents have been using for anxiety in their kids.
Yeah, so typically traditional treatment options are you go see your pediatrician, and usually there can or cannot be some pharmaceutical involvement. But most of the time there's some sort of therapy that's involved there. But more so nowadays, people really want to know what holistic approaches are out there. What are some non-pharmaceutical interventions that we can do to help their child along, or to help them improve their child's just overall quality of life. And here at Foundations Wellness, we have some amazing tools to help those kiddos through the period of anxiety that they're experiencing, and or if it's been anxiety that's been lifelong, if it's a young child. We know that there is a connection between the gut and the brain. So really, anxiety is not a normal thing. There are many different factors that play into anxiety, many different root causes. And here at Foundations Wellness, we have Zyto that can help clue us in as to what might be some of those root causes.
And Zyto is?
So Zyto is our bioenergetic feedback system that we use to scan our clients to see what might be the triggers, such as certain pesticides or herbicides like glyphosate or Roundup. Certain foods, could be gluten, could be dairy. Zyto helps clue us in as to what might be triggering that anxiety. And then we can sort of work and fix the root cause issue.
And doesn't it just floor you every time? I know it does me. How often we see pesticides and herbicides alone, or mold. coming up on the scans of these kids. And then oftentimes when we have some of the parents do some diagnostic testing, some urine testing to kind of validate that, it validates it.
Absolutely.
And it kind of hurts your heart in a way, because you're like, wow, this family has been so focused on therapy and counseling and the medications, when all along it could have been mold in their house, or it could have been the pesticides and herbicides in their food and water. And I think that's what Jen does so well when you meet with these families, is to help them think outside of that box. You know, what could be causing this anxiety besides just an emotional trauma or something psychiatric, which we know that can be those things, but oftentimes there is that, like you said, when you mentioned the gut-brain connection, what does that mean?
Yeah, so Teresa, we know there is a connection between the gut and the brain via the vagus nerve. So the vagus nerve ends in the gut, and one end of the vagus nerve is in the gut, the other end is in the brain. So speaking, to take it a little bit deeper, talking about pesticides and herbicides and foods that could be stressors, all of those things can cut back on the diversity of the microbiome in the gut. So when you have a less diverse microbiome, you are sort of limiting your immune system, really. And it is suppressing, it's not giving your immune system the boost that it needs to tolerate stressors, to be able to handle an intake of pesticides and herbicides. So here at Foundations Wellness, one of the many tools that we have to deal with anxiety in kids specifically is we dig deep into what can we do to help build diversity in the gut and help build a more robust and strong microbiome.
Yeah, something else that I wanted to bring up was when you went to the Pediatric Brain Summit out in California earlier this year, they were talking about the brain as the second gut, or what?
Yes. Yeah,
I'm probably saying that wrong.
Yeah.
But...
No, so the gut is the second brain.
Okay.
Yes.
I knew I was messing that up, but
so that is right. So the gut is really the second brain, and or really the gut is the first brain. So the gut really is the house for 90 somewhat% of the immune system. So it is so vital that our gut is diverse, our microbiome is robust, so that when our gut is in check, for lack of better description, your brain is also in check and not anxious.
Yeah, Dr. Stephanie Seneff, who has done award-winning work around glyphosate that you've mentioned multiple times, the main ingredient in Roundup, really has proven that Roundup alone messes with that microbiome, the good bacteria. It kills off the good bacteria so that bad bacteria like strep can really proliferate in the child's gut and create the PANS and PANDAS, and can create Clostridia overgrowth, which we see on our scans a lot, and can also create inflammatory chemicals from the gut that create brain inflammation and can create that anxiety and depression.
Absolutely. Badly
in kids. And so this discussion really gets both of us so fired up, because we're both of us so committed to kids and families, knowing, well, what else besides just emotional things can play into why that child is anxious. And what are some of the things that you really enjoy implementing to help those kids get better?
So probably one of my most favorite things and tools here at Foundations Wellness is the Ion Cleanse by AMD. So the Ion Cleanse is a detox foot bath that stimulates the parasympathetic nervous system so that your body can go away from that fight or flight response into parasympathetic response and more of a calm, less anxious feeling overall in the body.
And kids love it too.
They do.
They relax and they ask for it.
Mm-hmm. They do ask for it. They sleep better. They wake up feeling energized and more rested. That's probably my most favorite tool that we utilize here.
Yeah, so you get a couple of different benefits because when they do the foot bath, it puts them in that rest and digest parasympathetic mode. And it also helps their body to get rid of those pesticides and glyphosate, herbicides, heavy metals, mold, anything that's playing into that little brain on fire, that gut-brain inflammation.
That's right.
And anything else that you wanted to talk about, and just to give parents more hope around their kids' treatment for anxiety?
There's always help. There's always something out there. There's always hope. We have tons of hope here. We really believe that we will find a way and something that works to help your child. And overall, which would in turn help your family, just go through this with your child, and the goal of to get them to be less anxious and live a more happy, fulfilling life as they should.
Yeah, and we're already seeing that working very well.
Yes.
Families who are telling us, my child is completely better, or my child is completely different. My child is now doing well in school. My child is now interacting with their peers better. And that is so gratifying. So gratifying. Yeah. So I'm so thankful for you being here, Jen. And if you want more information around working with Jen and working on anxiety in your child so that your child can have a better quality of life, check us out.